Hi, good afternoon, everyone. I'm Gina DeLuca, registered dietitian with NYU Langone Perlmutter Cancer Center. Welcome, everyone. Today we're presenting on preventing breast cancer with a healthy lifestyle. I'll be presenting the nutrition segment. No disclosures to reveal. In the essence of time, we'll keep moving forward. So for nutrition-related topics, I wanted to focus on helping you to learn which foods can optimize health and prevent breast cancer, as well as learning how certain factors affect breast cancer prevention, specifically alcohol use, dietary supplements, and intermittent fasting. I'd say these are probably the three most popular non-food topics, so I wanted to include that too. So yes, people are interested in preventing breast cancer. As of 2025 stats with the American Cancer Society, over 300,000 women and over 2,000 men, as you can see, are estimated to be diagnosed. So this is definitely a topic that gleans great interest. As you can see, we're looking forward onto the horizon, and here at NYU Langone Health, always moving forward in terms of learning as much as we can and discovering what we can to help people. So I always go back to this. This study was done in 2017. It's an oldie but goodie, if you will. The dietary guidelines for breast cancer that were delineated in this, were really, really helpful to kind of show that nutrition assessment immediately after diagnosis is helpful. Now, again, we're talking today about prevention, but there's just so much overlap between prevention, even into treatment, even into survivorship. We're treating whole people. So sometimes it's hard to separate that out very distinctly. So what I like to do is kind of take, out of all the studies, out of all the research I can find, what really speaks to me. And this has spoken to me. And so I thought, if we're looking at this in treatment, why wouldn't we look at this in the preventive aspect? So what this spoke about, which I've always appreciated, is that the focus is on preserving lean body mass. So as we know, that ties into our immune system and our strength, and in conjunction, avoiding an increase in fat mass, with the connection with estrogen that way. What we want to always do is personalize nutrition intervention. So we're looking at dietary habits, schedule, activities, cultural preferences. We want to make things sustainable and livable for people. With the daily energy intake distribution, again, that's a rough outline. We're looking at our macronutrients. We're really trying to optimize healthy fats, polyunsaturated fats, as well as monounsaturated fats, but those fats that are found in plants, that's what we want to focus on, so that we take the focus off of the fats that are found in animal products. That saturated fat in animal products can sometimes be a risk factor for breast cancer. So we really want to focus on the power in plants. 55% whole food carbohydrates, your grains, your fruits, again, whole foods. We're not talking about refined carbohydrates. We really want to focus on that power in the whole food. And then protein, making sure that we have adequate protein. Fish in particular contains essential fatty acids that are helpful. So there's some overlap there with the polyunsaturated fats, but we really, again, want to focus on our plants, 5 to 9 servings per day of fruits and vegetables. With this, we're getting natural antioxidants, fibers, phytochemicals. We'll, again, touch on supplements later, but we really want to look at these nutrients from our foods and food-based sources specifically of the vitamins and minerals that are listed. And again, that really is covering the whole gamut. There's so much synergy with how the foods and the nutrients work together. Again, it's really hard to separate things out sometimes. So we want to focus on that power therein. And particularly cruciferous vegetables. So as we've got in our picture, our cabbages, our broccoli, cauliflower, etc., along with garlic, are really powerful in how they, again, synergistically work together. So diet patterns impact breast cancer. That's absolutely true. And again, foods to focus on, to choose. Again, really trying to focus on just whole foods, avoiding processed foods, organic when possible, particularly for dairy. That way we're, really focusing on good, clean nutrition in the dairy products. And again, whole grain foods and root starches that a lot of times can provide resistant starch in the gut and really help to move everything through in a healthy way. Soy and flax can be safe, and they deserve special mention, and they're going to get their own slide next. But really to focus on the foods to avoid as well. And again, little bits here and there. We don't want to completely, tell people they can't have something. I think sometimes that, sets us up to want it more. Little bits here and there on special occasions, fine. But this is focusing more on what are we doing on a continuous basis. Okay, so again, really processed foods, refined foods, excessive red meat from non-organic sources, again, with the saturated fat connection and the other, hormone-related and antibiotic-related connections and things. Okay. So plant foods of interest. So for soy, so it's really important to focus on the fact that phytoestrogens, which are plant estrogens, are not the same as our body's human estrogen. Current evidence indicates that it is safe for women who have had breast cancer or who are at risk for breast cancer to eat soy foods. However, it's uncertain whether soy supplements are safe for these women. And I apply that to men and to all people as well, because again, that processing that happens in those soy components sometimes is the concern. Soy protein isolate or different, let's say maybe chemical ways or just ways that it's not in that whole food form to offer the protective components the same way. So we really want to encourage people to aim for non-GMO, organic, whole food soy sources when possible, as shown in the picture. And again, the protective effect of those plant compounds is so key because of the anti-inflammatory properties therein. So we also want to look at flax too. Flax has really been amazing in terms of, it's such a nutrient-rich substance, and there's such let's see if I can move this up over here for me for a quick second for you. Basically, we're looking at increasing that consumption of lignans, which are the specific phytoestrogens therein, and those have been linked to a decreased risk of breast cancer. So it's actually an anti-estrogenic effect that occurs and disrupts the human estrogen metabolism, basically binding to those receptors and potentially reducing the growth of estrogen-sensitive cancer cells. So current recommendations are, and just to mention too, always ground flaxseed. It's very hard to digest the whole seeds, so it's not the same benefit potentially. So we can go anywhere from 1 to 4 tablespoons per day safely, not really needing more than that, and then you can get into maybe some digestive issues. So really kind of focusing on that. And what's wonderful about flax is that it's so versatile in terms of how you can incorporate it into your diet pattern. So, these two really stand out as winners. So diet quality is what we're going to focus on for a few moments. Thinking of nutrition as a vital sign, just as we would the other vital signs, it really is powerful. Diet quality is key. Next slide, please. So this I thought was interesting in terms of diet quality index. So Purdue University Center for Food Demand Analysis and Sustainability has a survey that they conduct, and this is done in association with the Mayo Clinic. So the Mini-EAT, the EAT is an eating assessment tool. And basically what it has shown is that an estimate of diet quality based on a short survey that elicits consumption frequency of different foods. So again, we're looking at whole foods, but we are looking at some refined and concerning foods in there. So again, pulling out which ones are, let's say, Mediterranean diet pattern-based, oncopreventive versus standard American diet or potentially oncogenic. So we're looking to either prevent cancer cells or encourage them. And of course, we want to prevent them. So what was interesting about this was that the adults that were surveyed, and adults were surveyed monthly to monitor consumer food behaviors, as well as these other factors, it showed what you'll see on the other side of the slide here is that the number one thing that people chose food based on was taste. Now that is awesome. That goes without saying. We have the sense of taste where we want to be able to, utilize that. Affordability was also key, but nutrition was third. And the part that was challenging about this and concerning is that the taste factor correlated more with ultra processed food and just processed food in general. So taste in that sense, more than taste in whole food. And so that can get us into a tricky pattern. Now, accounting for diet changes that occur in real time is important, and this did. We want to look at things that happen at higher frequencies, unlike some other eating indexes and diet quality indexes, because again, we want to factor that in. It's always sort of a relative balance. So we want people to enjoy, but we also want to make sure that nutrition is at the forefront in terms of prevention. So this I always like to mention, just to kind of put it out there in terms of, again, ultra processed food, also known as UPF, weight gain and cancer risk. So with the chart, what that had examined was the fact that calorie for calorie, people gained weight faster eating processed, ultra processed food specifically than whole food. Again, really concerning because people get frustrated. I'm eating the same amount of calories, I'm gaining so much weight. But if we look at those components, that's usually the key factor. And correlating that to cancer, what we want to look at in terms of here is that there was a 10% increase in the proportion of ultra processed food in the diet was associated with a significant increase of greater than 10% in risk of overall and breast cancer. So again, specifically applying it to breast cancer and how we can, just really target, again, focusing on that whole food is so, so powerful. So a case for whole food. Plant-based diet patterns need to include whole foods as primary sources of fiber and other bioactive components for anti-inflammatory and anti-proliferative, which are increasing cell growth effects. Conversely, less healthy plant-based foods that are poor in fiber and micronutrients and laden with, again, refined carbohydrates can have anti-inflammatory and tumor-promoting potential. So again, we want to move toward that whole food. It's good for both chronic disease prevention as well as planetary health. So we're looking at not only ourselves, but our generations to come. So the American Institute for Cancer Research is always one of our favorites in terms of just the information that they offer, especially regarding nutrition. The New American Plate was created, and we like to look sort of in thirds. So if you look, about 2/3 of that plate is plant food. And then you can include the other third to be animal protein. Again, choosing leaner cuts of protein, animal protein when possible, but you can also substitute plant-based protein. So again, we're getting into more fiber, more vitamins, minerals, etc. when we do this. And, sometimes taste-wise, that just balances things out for people. Sometimes, I find like we interview our patients and I feel like a lot of people tend to eat chicken. Sometimes you just want to switch it up. And that really offers not only a healthy, but a really versatile way to do so when you add that plant-based protein in there. And, again, if you can, mixing up the colors of the vegetables. So maybe including various colors, if possible. Again, that's just going to help you. You can also add a fruit serving and a dairy or a dairy alternative on the side, especially ones therein that are fortified with calcium tend to be, ones that people focus on. But that balance we found to be really powerful. So again, I can't say it enough. Plant power supports our microbiomes, which is our digestive system, our storehouse of good bacteria. We really want to consume all of the different plant-based foods that we possibly can, because they all offer different benefits, and together they help strengthen that microbiome through prebiotic fiber. I would say prebiotics are the food that feeds the probiotics, so we've got to really support that. Decreasing inflammation, offering so many benefits for so many body systems and functions. Cancer prevention is at the forefront for this talk, but again, thinking about how we're protecting our heart health and preventing strokes, preventing diabetes, the list just goes on and on. And they really lend a delicious quality to foods and meals. I think it's so amazing that the colors and the textures are what give, just that, those phytochemicals lend those components, and then that gives that essence to food that makes it different, that makes it enjoyable. So this is where we're going to move into just a little bit to touch on something that I found to be fascinating in preparing this. Culinary medicine. And this is just a quick touch on, but this is the nexus. This is where I feel like, the rubber meets the road, so to speak, for how we take our nutrition education and we translate it into how, just anyone, but particularly like when we help our patients, how that can help. So it's an avenue for interdisciplinary nutrition education, intervention, utilizing the expertise of dietitians, physicians, and other healthcare professionals. So this is, again, sort of that space, like not only where we can translate that information, but we can all come together as a team and collaborate and help. Who doesn't need to eat? We all do. So it's great. So Mediterranean diet, we can't emphasize this enough, because in so many studies and just all around, this is what really, again, comes up as just so powerful. And I think it's important to mention too, like, again, picking out in any culture, any cuisine, the foods that are anti-inflammatory, again, those like common threads throughout, that's where it's at. But just mainly for this, I focused on studies on the Mediterranean diet pattern in particular. So overall, what they found is that, of course, as we know, it's nutritionally balanced, anti-inflammatory, including whole foods. And this was really, really awesome because an education and culinary-based intervention in breast cancer survivors successfully increased adherence to more Mediterranean-style anti-inflammatory dietary pattern by increasing consumption of anti-inflammatory foods, spices, and herbs, and decreasing consumption of pro-inflammatory foods. So it's almost like when we take something away, we want to fill the space with something good. So what this specifically showed was that there was an increased fish and shellfish intake, a decreased red meat intake, and then also decreased commercial sweets and baked goods. So again, replacing the refined, processed foods with whole food. And I think it is important just to mention here. So again, we've got our fish for our omega-3s, our healthy fats. Shellfish, honestly, sometimes I find just in my practice, people will mention like it does get a bad rap. It's a lean protein. It does have cholesterol, but dietary cholesterol isn't necessarily what's going to bring up our blood cholesterol levels. It's the dietary saturated fat intake that's more apt to do that. And if people have a history of high cholesterol or history of family history of high cholesterol, then they might want to be a little bit more careful. But shellfish has so many vitamins, minerals, it can definitely have a place like all these other foods. And again, if we're varying things, we don't have to be as concerned. But specifically in this, increased cinnamon, turmeric, garlic, ginger, black pepper, and rosemary intakes were found. Awesome. I mean, right there, it's just so delicious. And the way that it enhances the taste and smell quality of meals is just phenomenal. So I thought that was great and wanted to share that with you. So, however, there are still some key issues and prospects to consider. So expanding cohort studies to include more regions is key, again, because we never want to limit to just one area. We want to kind of expand our horizons in terms of different regions and what people are specifically eating and what can we learn from that. Promoting a specific criteria for the components to enhance comparability across various studies. So, again, just really kind of maybe in a way standardizing, factoring in different things, but finding a way to kind of be able to apply that rather than just small studies here and there. How do we kind of broaden that? Investigating the molecular mechanisms and synergistic action of individual components within the Mediterranean diet. So again, like we know it works, but how can we even, drill down deeper and get more information on mechanisms of action? Because I find, for myself, when I understand that, it's more powerful. When we can explain that to people, it's more powerful as opposed to, just a very vague understanding. Sometimes having that specific understanding makes a big, big difference. And then investigating the impact of personalized genes and microbial factors on the anti-cancer effects. So again, that microbiome, we are each as individual as our fingerprint and our microbiome. So how do we learn about that and really apply our nutrigenomics type of information? I've always thought that has to have a place in what we do. So I'm really glad to see that starting to increase over time now. Tools for implementation. So the behavior change element is, again, key. That's the nexus. How do we apply what we learn? Harnessing that power of whole food, involving physical activity, which Dr. Zhu is going to speak to you about. But this I thought was so awesome in the study because there was an increased knowledge and utilization, more plants, less processed meat. So right there, just powerful, a demonstration of what can happen. Also, increased moderate physical activity demonstrated improvements in cardio as well as resistance exercise and improved vegetable consumption trend in the home-based mentored vegetable gardening study. I thought that was pretty fascinating too. And again, I think it's about meeting people where they're at. Not everybody might have a huge piece of land to have a tremendous garden, but you can start by, maybe growing some small herbs, like I'm going to show up there. Every little thing that you can do, it matters and makes a difference. So I have to always include hydration because truthfully, I think it's the foundation of what we do in our nutrition, even more than food can be. It's really, sort of the stream that keeps everything flowing. So it's foundational, essential for proper body function, especially for metabolism and moving those nutrients through where they need to go. Fresh, think of fruit essences, often including citrus optimizes taste. This is usually key for people on treatment, but again, not only does that have a taste benefit, it has immune benefits and different components like that. And functional, what benefits can we glean from some of the herbal and green teas that offer benefits while limiting caffeine intake? More and more is coming out about different herbs, so I'm always, really excited to learn about that. So alcohol, I always have to touch on this as well because this is a tremendous risk factor. I'm just going to move that down right there. It, of course, is a risk factor for developing breast cancer. Compared to women who do not drink at all. And again, that was just that particular study, but to people in general, even one glass of alcohol a day may increase the risk of disease. So it was staggering when I first learned, you'll see the table to the side, and how that rate increases exponentially. So I always try to offer that to people because, again, I think when you see that and you think, well, 2 or more, maybe that's not so much. But then when you see the increase in the percentage of risk, again, staggering. And particularly if you have a family history, I would say that could be an even further increased risk. So the current recommendation is that women should have no more than 1 drink per day and men no more than 2 in the proportioned amounts per type of alcohol. So I think that's key too, to make sure that when we're within those volumes, that's where this correlates to. If it's more than that, it's going to increase that risk potentially even faster. So dietary supplements, I often get asked a lot of questions about this, as I know my team does as well. A whole food, plant-based way of eating that provides nutrients in packages. That's essentially how we want to look at that. These packages contain various nutritional components that are meant to work together. When you take supplements, your body usually processes isolated nutrients less efficiently because, again, they need that team approach, that team effect. Nutrients need other nutrients to be absorbed and utilized most effectively. And unfortunately, sometimes taking isolated nutrients, unless there's a medically diagnosed clinical deficiency, it can throw off the balance of other nutrients. And so we think we're doing a good thing, and then we end up creating more problems. So it's always very important to talk with your healthcare team before starting anything. Everyone is unique, so we want to make sure that that is assessed in the context of all the medications you're on, all the health conditions you might have, and just make sure that it's as safe as possible. So intermittent fasting, this, as we know, has exploded in different ways in our society in terms of, we get asked a lot of questions on this too. It's also referred to as time-restricted eating. What it does is it puts the body in a fasting state for a period of time, focuses on time schedule rather than selected foods in most cases, maybe not always. Maybe people are selecting their foods, based on a particular diet pattern, but I find sometimes in practice that's not always the case. It's more just eating whatever is chosen, but during that time schedule. Prior early stage research, small scale studies that were conducted in lab settings. So again, in a very controlled environment versus in the real world or, out there with all the other components of our lives, showed improvements in blood sugar and insulin levels, weight management, treatment efficacy, and chemotherapy-induced toxicity. So IF during chemo was found to be feasible, safe, and able to reduce chemo-induced fatigue, nausea, and headaches to some degree in that particular study. What I think we're always keeping in mind is that there are some contraindications. If there's malnutrition present, this may not be safe in terms of, or may not be effective or efficient. We're losing opportunity to get energy in when we need to. It also might not be safe in terms of someone needing to eat more frequently. In the case of eating disorders, as well as blood sugar disorders and diseases, we are, really needing to take a look. Again, I don't like to say never, but truthfully, we really have to be super careful, and most times it's going to be contraindicated, if not at all times. So what we come back to with this is that sustainability is key. We want to keep it simple. Eat when you need to. Don't eat when you don't need to. What your body needs for energy, take the energy, use it the way that it needs to. But let's, maybe try to curb the pattern of overeating or eating ultra processed foods. And so there's one study that I always do like to mention, because this was about the only human study that I was able to find, and I think most of us have been able to find, pertaining to breast cancer risk reduction. Fasting for fewer than 13 hours per night was associated with a 36% higher risk of breast cancer recurrence compared to fasting 13 or more hours per night. So that just is what it is. But again, we do need to focus on ensuring patients attain adequate nutrient intake, sustain muscle tissue and lean body mass, and avoid disordered eating patterns. And considering on a case-by-case basis then is key. I think we don't want to go way more than 13 hours, because we might miss that opportunity, but going that or a little bit over maybe looking at it from the perspective of it's an opportunity to get more sleep. And we can always benefit from that because our body really repairs well when we sleep. And I think then leading into creating that shift in thinking, let's bolster natural immunity, have adequate nutrition, physical activity as feasible, adequate sleep, management of stress, eating more plants, really again, focusing on those bioactive foods, eating when we need to in terms of, just gonna kind of move this up here for a second. Just getting those foods in so those foods can work together and they can really give a strong benefit. There is more consensus than any controversy among the literature and all the guidelines for plant-based eating. So, the bottom line is, I would say, do it, in whatever way that works for you. Start small if you need to, but build that foundation. It's really going to pay back dividends. And in this regard, individualizing meal patterns based on personal food preferences, ethnic, cultural, religious traditions comes into play because, again, we're all different and we want to make it sustainable.
Good afternoon, everyone. My name is Yingrong Zhu. I'm a clinical assistant professor of physical medicine and rehabilitation. I practice oncologic rehabilitation and lead the oncologic rehabilitation program at NYU. Today, I will be talking about exercise for breast cancer prevention and recovery. One thing that stood out to me amongst the myriad of excellent information Gina just shared is how she said that there is such a continuity from, prevention to diagnosis to treatment and survivorship. And I absolutely agree with that. A lot of this is really, really interrelated. And it's about living a healthy lifestyle, for the whole patient, for their life, and not just for a segment of their life, either before or after disease diagnosis and treatment. So first, I want to start with this statement. Physical exercise has been shown to lower the risk for 7 types of cancer: colon, breast, endometrial, kidney, multiple myeloma, liver, and non-Hodgkin lymphoma. Of course, today we'll be specifically focusing on breast cancer. The questions are why, what, and how. Why should we exercise? What kind of exercise is recommended? And how can we go about doing the recommended exercise? What we know is that physical activity can reduce breast cancer mortality and recurrence of breast cancer, as well as reduce the number and severity of adverse events and adverse effects following and during its treatment. Unfortunately, women with a diagnosis of breast cancer tend to reduce their physical activity levels by 11%, with an even greater decrease in patients who are undergoing chemotherapy and radiotherapy compared to untreated patients. Physical exercise has a lot of benefits for health, including reducing fatigue, improving mood, improving sleep quality, improving muscle strength, bone health, and range of motion. And perhaps most importantly, physical activity has been shown to strengthen your immune system, which allows your body to not only better fight off external invaders from the environment and illnesses, but also things like cancer. When it comes to exercise, there's 2 main types of exercise: aerobic exercise and resistance training. Aerobic exercise is the type of exercise that's meant to increase your heart rate, increase your breathing rate, and increase cardiovascular health. Common aerobic exercises that people do, engage in, and hear and see include walking, if you speed walk, running, jogging, swimming, and cycling. Whereas resistance training is what we think of as strength training, weightlifting, and it's a type of exercise that's meant to increase the strength, the endurance, and bulk of your muscles. This could be muscles in the upper body, lower body, core, back, and any other areas of the body. These are 2 types of exercises which work together to help improve our health quality. And depending on what treatment we're looking for or what condition we're looking to treat, we may recommend one, the other, or a combination of the 2. This is an infographic from the American College of Sports Medicine, specifically with their recommendations for the type of exercise between aerobic versus resistance versus both for certain health-related outcomes in patients with cancer. You can see for many of these conditions, they recommend actually a combination of both types of exercise. Whereas in other types of conditions, they find that one exercise between aerobic and resistance is more helpful than the other. There's strong evidence for exercise for the treatment of cancer-related fatigue, health-related quality of life, overall physical function, anxiety, depression, and bone health. When it comes to recommended exercise quantity, the American Cancer Society recommends for cancer survivors to avoid inactivity and return to normal daily activities as soon as possible after diagnosis and treatment. For many of our cancer patients, they often engage in much less physical activity during cancer treatment compared to what they previously did at baseline. The reason for this is multifactorial. Oftentimes, when patients are going through cancer treatment, they may have increased fatigue or deal with the other myriad of side effects from the treatment, like nausea, dizziness, decreased sleep, that can all affect how comfortable they feel doing exercise and how much energy and capacity they have to do exercise. So once they're over kind of the most intense side effects, and once they feel ready, it's important to start increasing physical activity again. What I tell people is any activity you do is better than no activity at all. And that's also true for patients who at baseline are not exercising, but are ready to make a change in their lives. It's important to start slowly and to build up the amount of physical activity over time. It's incredibly difficult for someone who lives a primarily sedentary lifestyle to suddenly start training for a marathon. But it's much more easier, much more manageable for someone to say, start adding a 5-minute walk a day, build up to the 10-minute walk a day, eventually 20 minutes a day. And before you know it, they'll be able to walk 30 minutes a day or engage in other type of physical activity for that length of time. So the amount of exercise that's recommended is for 150 to 300 minutes of moderate activity each week. But again, it's very difficult to get to this point if you at baseline are not doing any exercise. So I encourage you to start with those 5 to 10-minute walks and build up from there. The American Cancer Society recommends that each time you exercise to do at least a 10-minute session, as well as to include resistance training 2 days a week, and to also add stretching exercises at least 2 days each week. I would say when it comes to stretching, this is something that we talk very little about in American exercise culture, even though it's a very important part of physical activity. Stretching helps improve mobility, as well as helps decrease risk of injury once you start doing more intensive exercises. Flexibility is gained through stretching, and having flexible joints, flexible muscles and tendons can also help decrease certain types of joint pain that's related to too much stiffness and immobility. Stretching is also particularly important in patients who have a history of breast cancer, especially after breast cancer treatment. After breast cancer treatment, patients often find they have a lot of decreased mobility or tightness across the chest and the shoulders, as well as the sides of their trunk. And this could limit them from being able to do things like get dressed, brush their hair, or reach up to take things off of shelves. All very important activities for day-to-day life. The stretches I recommend for breast cancer patients typically include what I call wall crawls. So this is a stretch where you stand facing the wall, put your hand on the wall, and crawl your fingers up the wall to as high a point as you can. Once you get to as high as you can, I recommend holding for 10 to 20 seconds. If you're doing this stretch and you're finding it to be too easy, I recommend standing closer to the wall when you start. The closer you stand to the wall, the more challenging the stretch is, and the further, the easier. And this is a stretch you can repeat on both the left and the right side. Another good stretch for the upper chest area is a stretch in the corner of a room where you put one arm on each wall while standing in the corner, put one foot inside the corner, and lean into it. This is an excellent stretch for opening up the pecs. And it's actually helpful for all of us as we all tend to live, in front of screens in modern society. So a lot of us tend to have hunched forward postures. When it comes to aerobic exercise, the quantity that's recommended is 150 minutes a week of moderate intensity aerobic exercise. This means while doing that activity, you should be able to talk, but not sing. If you can talk while if you cannot even talk while doing this activity, it is too intense, and if you can sing while doing it, it is not intense enough. The most common types of aerobic exercise include running, cycling, swimming, and walking. What I want to caution you on is that if you are walking, you need to walk at a higher intensity than probably what you're used to get to this level of moderate intensity. Most people, when they walk at something we call the self-selected gait speed. It is the speed of walking where you feel very comfortable. If you're walking at that speed, it typically is not intensive enough to become aerobic exercise. You will have to focus and really push yourself to get to the point that you're short of breath enough that you cannot sing while doing this activity. Of course, there's also other types of aerobic exercise that include dancing, using elliptical, and other activities like that may fit your lifestyle better depending on what your typical hobbies and interests are. If you have joint pain, for example, in your knees or your hips or your back, you may find that running can be difficult or uncomfortable. In those cases, cycling and swimming might be a better option of aerobic exercise. Cycling and swimming are both low impact on the joints and can be helpful for increasing the heart rate and respiratory rate without putting additional pressure on the joints of the body. For people who have a lot of joint pains from osteoarthritis or other reasons, swimming or water aerobics can be excellent exercise that helps increase strength and endurance without putting any extra pressure on those joints that can lead to pain, because the buoyancy of the water helps offload some of the joints while doing exercises in that setting. When it comes to resistance training, I recommend that you aim to perform it 3 times a week, about 30 minutes each time, and try to exercise all of the major muscle groups in the body. For example, the arms, legs, back, core, and chest. Now, I'm not recommending that you exercise all these muscle groups on the same day during the same session, but rather that you break them up into different sessions. For example, on Mondays, maybe you'll do arms and back. Maybe Tuesdays, you can do core and chest. And later on in the week, you can do legs on a different day. Resistance training is the exercise typically people think of as weightlifting, but you can also use your own body weight to increase that resistance and to help your muscles strengthen themselves. For example, a squat is an excellent exercise for your gluteal muscles as well as for your legs. You don't need any additional equipment to perform it, as you're using the weight of your own body to increase the muscle strength in those muscle groups. If you find that a squat is difficult to do, we can start with sit to stand exercises instead for the lower body. This is an exercise where you start from a sitting position in a chair and you stand up from the chair without using any assistance from your hands. So you can either cross your hands over your chest or hold it out in front of you so that you're making sure you're not using your hands to help push up. This is a good exercise to start if you're first starting to exercise and you're typically sedentary at baseline. The higher the seat you start from, the easier this exercise is. So if you find that it's difficult to get up from a chair, you can start from a higher seat level or a seat of a higher height, and then do sit to stand exercises. And as you progress, you can start from lower and lower seats. If you do 20 of these in a row, I guarantee you will feel it in your thighs. When it comes to the upper body, you can work with either weights or resistance bands to increase your muscle strength. If you don't have access to a gym or you don't own weights at home, that's okay. You don't need to go out and, purchase access to those things. You can use household objects as weights when you first start. For example, bottles of water or cans of beans. Those are typically about 1 to 2 pounds and are a great place to start if you're first starting to work out. Different exercises you can do for the upper body include bicep curls, overhead shoulder presses, and dumbbell rows. For breast cancer patients, I typically recommend that they do regular exercise for the upper back muscles. So those rowing exercises we talked about. Again, because of how we live in modern society, all of us kind of forward in front of our screens or our desks and our computers, we often all have much weaker muscles along the back of our body compared to the front. because we don't use those muscles in our typical everyday life. And the spot where the body has the least amount of pain and the best health is when the body itself is balanced, both in the front and the back. So it's important to do those additional exercises to strengthen the back of the body. Good core exercises include things like sit-ups, crunches, planks. Planks can also help increase the strength of your arms as well as your back muscles. And it's recommended to kind of do a mix of those different exercises so that you're making sure that you're exercising all your major muscle groups. If you're finding it that it's very difficult to create these blocks of time to start an exercise regimen, what you can do is incorporate physical activity into your everyday life. So there's a lot of different ways that you can kind of sneak it in throughout your day for all of our busy lives. For example, if you're watching TV, you could use a stationary bike or a treadmill while watching TV. You could do those body weight exercises during commercial breaks, the squats or the sit to stands, or grab some water bottles and start doing some arm exercises. You can use the stairs rather than take the elevator. Or if you're in a building that's on and going to a place that's on a very high floor, you could get out of the elevator 1 to 2 floors ahead of time and walk up the stairs the rest of the way. If you drive, you can park in a further parking space so that you're increasing the distance you have to walk to get to your location, your destination, and the distance you have to walk to get back to your car. During your lunch breaks, you can exercise with your coworkers, family, or friends. If you do mostly a desk job or spend a lot of time at your desk during the day, you can take exercise breaks to go for a stretch or take a quick walk. Ergonomic experts recommend that you get up from your desk or your chair every 15 to 20 minutes throughout the day, and definitely no more than every 30 minutes, or no less frequently than every 30 minutes. You can try to walk to your coworker to speak with them instead of phoning or sending an email. You can plan active vacations rather than only sightseeing trips or bus tours. Many people find it's helpful to have a wearable device that tracks their number of steps so that it kind of gives them a sense of how much walking they're doing, and also gives them a sense of, it gives them a goal to work towards if they have a number that they're trying to hit. If you're interested in sports, you can also join a sports team to help you stay more active. And if you have any younger children in your life, whether it be your kids or your grandkids, you can play active games with them, like freeze tag, jump rope, or running around with them at the playground. Most importantly, make it fun, right? If it's something that it's fun, that's enjoyable, you're going to have a much easier time doing it than if it feels like a chore for you every day. Of course, when it comes to exercise, there are some precautions we need to take to make sure that the exercise is appropriate and safe for the person doing them. The first one is heart disease. For certain types of heart disease, there may be limitations of what is safe for the patient to do. So it's important to get clearance from the cardiologist for the intensity and type of exercise to make sure that it's not stressing the heart too much in patients with heart disease. Some patients have a lot of fatigue at baseline. If the fatigue is so severe that it's difficult even just to get from point A to B, this may not be the best time to start exercise. They may need some additional rest to kind of recover from the setting. If you have acute illness, you may also need additional rest, and that may not be the time to push your body. If you have balance problems, or if you have neuropathy that affects your balance, it's important to make sure that the exercise you're doing is safe from that standpoint and not going to increase your risk of falls. For example, someone has a lot of balance problems, maybe cannot safely exercise from things that's in a standing position because they might risk falling. And so perhaps they should do modified exercises from a sitting position or from a lying down position instead. If you are lying down flat, there's still a lot of different good exercises you can do. For example, leg lifts, where you take your legs, you hold it slightly above the surface that you're on, and then raise them up as high as you can, bring them back down to just slightly above the floor, and do that, repeating for about 10 to 20 times. It's an excellent exercise for legs and for core muscle strength. And that's just one example of exercises that can be done from a different position. If there's a risk of lightheadedness or a history of dizziness, that's also a time to be careful about the type of exercise, again, because we don't want to increase fall risk. If a patient has bone metastasis, that's also it's also important to be cleared by their physician for the type of exercise that they're doing to make sure that they are safe. Or if there's a history of osteoporosis or osteopenia, it's important to make sure that the exercise itself will not overstress the bones and lead to risk of fracture. Typically speaking, weight-bearing exercises, such as walking, is actually good for bone strength because when you are bearing weight through your bones, like when your bones has to hold the weight of your body, it sends a signal to the brain that the bone needs to be strengthened in order to take on the task that it is being required to do. So it is recommended to do that type of weight-bearing exercise. However, it's important to avoid things like high-impact exercise, perhaps jumping up and down, or anything that leads to pounding on the bones, as that may put too much stress on those delicate bones. For people without bone metastasis or history of osteopenia or osteoporosis, there's typically no issues with any concern about the strength of the bones from exercise or risk to the bones from exercise. If someone has an immunocompromised status due to low white blood cell counts, whether it's from a medical condition they're going through or a side effect of their treatment, it's important to avoid exercising in areas that has a high density of other people due to the risk of infection from communicable diseases. For these people to exercise, it's more recommended that they go somewhere that either is less densely populated, perhaps in outdoor parks where they're further away from other people, or in an area that has strict cleaning protocols. And blood counts is something that's also important to take a look at. Hemoglobin and platelet counts specifically. With lower hemoglobin counts, people can have increased fatigue, lightheadedness, and that might not be a good time to exercise until their blood counts come back up. And with certain platelet count numbers as well, if the number is too low, there's an increased risk of bleeding, so it might not be safe to do resistance training, and the patient might be better off doing more gentle exercise, such as walking, for instance. And these are my references. And that's all from me.
So to keep it really simple, what I would actually say is a palm-sized portion. So what you can fit in the palm of your hand, give or take, for most foods. And we find that that's very, what's the word I'm looking for? Like user-friendly. Like you can take it on the go with you. You know, you don't have to precisely measure everything. I think just as long as it's not excessive, that's typically a good, you know, eyeball rule of thumb type of portion to use. You can get more technical with certain portions of things. A lot of it used to be based off of what we call the diabetic exchange list some time back, where, you know, especially for carbohydrate foods, things were very specifically portioned. But I feel like we've kind of moved away from that a lot, especially like in terms of that AICR plate. You know, you've got, again, just really palm-sized portions of pretty much everything. So I hope that answers. This was great. I'm glad someone did mention this because I think it's noteworthy to mention. So H/O is history of breast cancer.
Okay.
And to be very honest, in that case, I don't necessarily agree with it, only because sort of anecdotally, I remember when I first started in Mineola, we had a young patient who I think at one point was stage 3, progressed to stage 4, back and forth. Bottom line is she had done some collagen in between. Not to say that that's the definitive factor, I don't know, but it always stood out to me. It was almost like, I'll just always carry that with me on her behalf, like in her memory, because she did end up passing away. Again, not to say from that, but it was just a really profound case where I remember she used a lot of it at one point. And I just think it's one of those components that, because it can build tissue, when we take something in a supplement form like that, we don't always know where those cells are getting built. You know, we can think in theory, but in practice, how are we to know? So I always think better to be safe. And, you know, just by eating good quality protein, you can get, you know, the similar strengthening, building effect, you know, but in a safer way. hopefully. So I would probably discourage people from using it, especially with that history. And I think that too, things get really purported in the media, right? Like collagen is huge right now. But again, do we really need excessive amounts? I think there's a focus, like a hyper focus on protein sometimes. And, we just want to find that balance, make sure everyone gets adequate amounts, but not overdo it. Get more plants in there maybe to balance it out. So I think if digestively you can handle the flax seeds every day, I do think that's fine. I wouldn't exceed that 4 tablespoons. And honestly, that's probably a lot. If you're going to have it every day, a tablespoon probably would be adequate. Flax seeds, I'm sorry, chia seeds are great too. They have a lot of healthful benefits. So, and a lot of times they go well together. So you can easily mix them into different foods. So I think that would be fine. Again, I think it always gets deferred back to digestion in terms of how, because again, we're also different, how people are digesting consistently. So, Dr. Zhu, I might lean on you a little bit for this answer because I'm going to say possibly, but not necessarily. I'm thinking more in the osteopenia case, it might be just vitamin D is needed because vitamin D does help absorb calcium. We don't necessarily want to overdo it with calcium, but I think again, that too is a team approach. I'd probably, lean on our physicians a little bit or, tell the patient to really involve their team to see maybe depending on having testing done and seeing what's actually needed versus that. I don't know if you have any thoughts on that, Dr. Zhu.
Yeah, for sure. So I would say it depends on the stage of the osteopenia and osteoporosis. With all medical interventions, we always start with the least invasive medical intervention with the lowest risk of side effects. So if the patient has osteopenia, which is the stage before they get to full on osteoporosis, that is definitely the time to start making lifestyle interventions to help and prevent them from getting to osteoporosis, which would be more severe bone weakness. At that point, I would definitely make sure that they're taking adequate calcium and vitamin D. We are in New York City, and typically speaking, most people are pretty vitamin D deficient because we don't get a whole lot of sunlight in our everyday lives due to where we live in the country. And as a result, we don't have enough vitamin D circulating in our system. The other thing that helps to prevent bone loss and improve bone strength is the resistance training and weight bearing exercise I talked about in my presentation, because that's what sends the signal to the brain that the body needs to strengthen those bones in order for them to be able to do what is asked of them. When it comes to musculoskeletal system, a lot of what's going on in your body is use it or lose it, right? So if you use your muscles, they become stronger. And the same is true of your bones. If you use them, they become stronger. So the calcium and vitamin D are the building blocks of what strengthen the bones. And then the exercise is what tells the body that those need to be strengthened in the first place. So that's typically where I would start. If the patient isn't sure exactly what type of exercise they can do for their osteopenia or osteoporosis, they can work with a certified physical therapist who can give them specialized exercise regimen for this condition. Once that patient progresses to osteoporosis, depending on how significant their osteoporosis is, they should still continue this management because it's very safe. But if it's severe, it might be time to meet with an endocrinologist to discuss medication management for osteoporosis, because there are a lot of different medications on the market that can help increase bone strength. However, the medications, as we know, all have a long list of potential side effects. And although the patient themselves may not get any side effects, they potentially could also get a side effect from medication, and we can't really predict that. So we would definitely start with the lifestyle modifications first, which are safe and helpful, and then progress on to medication management if needed.
I'm going to say a fresh homemade anything is probably a better option. So, and not to be facetious, but I would say quite possibly, because then you're in control of what you're putting in that versus the additional processing, chemicals and things that might be used. So, yeah, I would say quite possibly, and that I think the other important thing and sort of note to end on is that we want to enjoy what we have. So if that's part of your culture and you're not having something all the time, but you're really enjoying it when you're having it, please do, because we want to definitely make that part of, again, that sustainable lifestyle.